Obesity in America, Breaking the Cycle by Ivana Dantes. The issue at hand. I'd like to start off with a quote by Michelle Obama. The physical and emotional health of an entire generation and the economic health and security of our nation is at stake. This isn't the kind of problem that can be solved overnight, but with everyone working together, it can be solved. So let's move. Problem. The problem occurs in Birmingham, Alabama, where the community has experienced an alarming increase in obesity. Currently, they serve a traditional Southern cuisine, and in addition to that, the school system does not employ a physical education program. Recognizing the need to address this issue, they are seeking to educate the younger population in hopes of breaking the cycle. Educating the community on obesity and preventative measures will meet Millennium Goal number 4 to reduce childhood mortality. Learning need assessments. In order to successfully implement any plan of action, careful assessment is needed to tailor your plan to a specific population at hand. Therefore, to thoroughly understand the needs of the population in Birmingham, Alabama, I have identified 5 key assessments I would like to address prior to developing my plan. Number 1. Identify the learning styles of the specific population. Number 2. Assess any barriers to learning. Number 3. Assess the current knowledge of obesity and how it affects them. Number 4. Assess knowledge on how to prevent obesity. Number 5. Assess support system within the school and within the community. Health promotion model. Social cognitive theory. Social cognitive theory explains behavior changes as an interaction between the individual, their behavior, and their environment. Behavior is a result of a complex interaction between those 3 factors. Therefore, approaches to change behaviors must incorporate all 3 factors to be successful. We should address the current knowledge and attitudes associated with obesity and as well as making a change within the environment. This is known as reciprocal determinism, which is the basis for this model. As you can see over to your right, there is a diagram that shows you the fluid and dependent relationship between all 3 factors. Health Education Plan. Goal: to increase students' confidence in maintaining behavioral changes by breaking down interventions into small and easily accomplished steps. Behavioral outcomes. I have identified 3 behavioral outcomes. They are as follows. Number 1, students would be able to identify and explain how to use resources available to them within their school and community. Number 2, students would be able to reiterate the importance of exercising and identify various physical activities that can be incorporated into their everyday lives. Number 3, schools will adopt healthier food choices into their nutritional programs using my plate diagram as a reference. Research. Evidence-based practice articles. Article number 1, title, Implementing Smarter Lunchroom Makeovers in New York State Middle Schools, an Initial Process Evaluation by Hills, Gaines, and Dolehite. This article recognizes schools' abilities to have a major impact on reducing obesity by supporting health through education, incorporating physical activity, and encouraging healthier eating through providing ideal food options. Like my educational plan, this article's goal is to promote accountability within the schools because it is a place where kids spend a majority of their day at. Article number 2, title, Childhood Obesity Public Health Crisis, Common Sense Cure by Ebeling, Powlock, and Ludwig. Like social cognitive theory, this article recognizes that in order for prevention methods to be successful, it must approach the issue not as an individual problem, but on a community level. Changes will result from the constant interaction between the individual, their environment, and behaviors. Article number 3, title, Is Obesity Contagious? Social Networks versus Environmental Factors in Obesity Epidemic by Cohen, Cole, and Fletcher. This article recognizes that many children, especially teens, are influenced by their peers. Therefore, things such as individual food choices and activity levels can easily be influenced by peers. Recognizing this relationship, I incorporated peer groups into my educational program so that kids will have the opportunity to share common experiences with their peers in hopes of influencing each other to make healthier changes within their lives. Evaluation. Evaluation method. Verbally obtain student feedback to assess the progress of the health promotion model and evaluate changes. Evaluation tool. To obtain student feedback, I will employ monthly peer groups that will encourage kids to share their experiences, expectations, and what kind of impact these changes have on their overall lives. Also, in doing so, kids will have a shared sense of accomplishment and will be able to motivate each other to continue through with their participation in nutritional and physical activity programs. Plans for the future. The secret of change is to focus all of your energy not on fighting the old, but building on the new. Socrates. Obesity is no doubt a prevalent issue within our society, but having a specific plan of action and measurable goals can help the effort to reduce the rising prevalence of such health issue. We must encourage change not only in individuals but on a community level because kids spend a majority of their time in school creating accountability within schools to make necessary changes within their nutritional and educational programs will pave the path towards a brighter future.